Hi, I'm Shelley Deitmeyer with Physical Therapy Solutions, and today we're going to talk a little bit about a treatment technique that we use in the clinic to help with some areas of muscle tightness or certain conditions to help kind of let us better diagnose what's going on with the tissues and gets to areas of the tissues that we can't always get to with our hands. This treatment technique is called ASTYM. And with the ASTYM, we use these different tools to perform this treatment technique. Now, ASTYM is an acronym that stands for Augmented Soft Tissue Mobilization. The Y is ASTYM, and the Y is just in there to help make it a word that we can use a little bit easier with educating people. So, with this treatment technique, we know that normal muscle tissue is usually nice and smooth and striated. It should be, I often explain to patients, it's like if you open up a spaghetti box and you have the noodles all nice and straight and lined up. That's normal muscle tissue. But sometimes after injury or surgery, you have, or even sometimes just after a long time of dealing with shoulder pain or elbow pain, you get what we call and develop fibrotic tissue. This is what I explain to the patients is kind of after you cook the spaghetti, you get kind of clumped up spaghetti, where that same thing can kind of happen in the tissues where it becomes kind of clumped up and it's not nice and smooth anymore. So the tools help us find those areas because when we rub along the skin, we can feel where the smooth areas are, and if we get an area of what we call fibrosis, we can feel that vibration through the tools. So it helps us kind of better assess what's going on and find the problem areas a little bit quicker than maybe we would with doing lots and lots of massage. That doesn't give us as clear of answers as we would get with this. So a couple things that the ASTYM does is, one, it helps us find where the problem area is. The second thing that it does is it helps kind of restart the healing process to realign some of those tissues. So we kind of stimulate that area, increase the blood flow to that area so that those tissues can heal normally. So once we've identified where the problem area is, my practice patient here now is Wincy, and with her, as I'm going along here, we'll often see this for people that have what we call tennis elbow. And oftentimes what we'll find is the tight area is this small muscle that attaches right to the elbow. So in her case, after I find that area that's tight, kind of feel a little bit of the bumps there, then what we do is we follow that up then with stretches to target that muscle to reteach those tissues how to lay down. So it starts the healing process and just helps it go along a little bit quicker. So we do the treatment technique, we do lots of stretches with it, and then we strengthen those muscles. And often after just a few visits, we can often see improvement pretty quickly. So that's a little bit about the ASTYM treatment technique that we use here at our clinic. If you might have any questions on whether or not that might be something that you could benefit from, feel free to give us a call and talk to one of our therapists, and we'd be happy to answer any of your questions.